welcome back to our YouTube channel. And my name is Julian Nachiaga. I'm glad that you're back to our YouTube channel. I'm the JICA PR and Secretary. I'll be interviewing a team at Entebbe Regional Referral Hospital in this video, and I'm excited that I'm in Entebbe because this is my hometown. So with me here I have the current hospital director, and he will introduce himself.
Yeah, good morning, good afternoon, good evening, members. Thank you very much for giving us this opportunity to talk about Entebbe Regional Referral Hospital. My name is Dr. Kyebambe, Peterson Stephen, Senior Consultant Physician, Trust Specialist, and Director of Entebbe Regional Referral Hospital.
And I'm here also with the Principal Nursing Officer. Please introduce yourself.
Thank you so much. My name is Mutonyi Roselyn. I'm the Principal Nursing Officer of Entebbe Regional Referral Hospital, the head nurse. Thank you.
Good. Thank you very much, Sister, and thank you, Director. I would like to request the Director to give us a brief introduction of Entebbe Regional Referral Hospital and its history.
We shall start by, we can't talk about it without talking about Entebbe Hospital, without talking about the town. The word Entebbe in the local language in Uganda means seat. It's a 200-bed hospital that initially started off in 1904. I think also began by surgical portal to treat members of the ruling class that was here at that time from the British from the British Protectorate. So in 1904 it started, and now it has been growing over the time. It became a district hospital. Up there, 2019, when it was elevated to become a regional referral hospital. So it is a regional referral hospital centered in the southern part of this area. It is mainly in Uganda, central Uganda, where it serves the districts of Wakiso, where it is located. It serves the districts of Mpigi, Butambala, Gomba, Mukono, and Karangala. So we have about 6 districts that we serve as a regional referral hospital, and we also not forgetting the Entebbe municipality, where we serve both as the municipality hospital but also as the regional referral hospital. So that is how Entebbe hospital is. Now, this hospital actually continues to have 3 campuses. The original campus is called Grade A, which was started by surgical portal in 1904. And then we also have Grade B, where we are, which was meant for the general public, which was by the colonial government. And now what we call Grade C, the National Isolation Unit, which is the left side. So, as I told you earlier, it is meant to treat highly infectious diseases like Ebola, like COVID-19, and others. So that we are in a place where there is proper isolation and management. So that is, the patients can be managed without the risk of transferring the disease to other members of the public.
At this moment, I would request Sister Roselyn and as well the Director to give us what 5S is, and also to give us their experience as Entebbe Regional Referral with 5S, the practices and the principles.
Okay. Basically, 5S is a sequence of activities that improve the work environment. These activities are done repetitively to improve your workplace so that you are always prepared at all times for any patient, any time, and then for standardization. You have a standard for your for your work. Everyone knows what is supposed to be done and where everything is, so that you give services to your patients and clients in time. There's no delays, but every service is given on time.
That's the beauty of 5S.
Yes.
What
please.
is the experience you have as the hospital director for the short time you've been around, and also Sister Roselyn, about 5S practices in Entebbe Regional Referral Hospital, and that you would like to share with other hospitals? What's your experience? And maybe also challenges that you're facing in implementing these activities and principles?
Yeah, I think you will matter for that. We are grateful for the 5S initiative because it has brought order. Previously we have heaps and heaps of things. Heaps of files lying disorganized in one corner, heaps of used boxes in another corner. Somebody has left their uniform in another corner, another one has left it on the floor, another left it on the table. So I think this kind of thing was quite disorganizing. But now with the 5S we are able to, people know what to do. They know where to put the bins, it's properly marked. They know where to put the linen. They use linen where it is. They used to where to put the files of patients who are discharged. Then they know where to put files of patients who are still on the ward. There's a lot of order, and that order makes work much easier because it's easier to identify where things are. It's also easier to implement initiatives like the infection control and prevention, because if there is order, then things flow and people can follow their rules and regulations quite easily. So we are grateful for 5S. It really helps to organize the environment, both make work easier, but also to also makes management much easier because people know what to do where, and there are proper guidelines and proper labels to show them what should be done where. So this time can
Yeah, to add on that, thank you, Director, to add on what the Director has just said, 5S is a very unique concept. It is very good because it is the foundation of all quality improvement activities. If you want to improve on quality, 5S is the foundation, and indeed it does wonders. The moment you start implementing it, you see great changes. For example, in this hospital, before we started 5S, I think we were disorganized. Not only the work environment, but even us, the staffs ourselves, the health workers, all of us were disorganized. But when we started implementing 5S, I think things changed. For example, the whole hospital was disorganized, wards were disorganized, cupboards were disorganized, patients were disorganized, everything. But when we began, we improved greatly. We got improvement in the environment, became so clean, the environment became clean. We improved, there was improvement in even the staff attitude, they improved greatly. Teamwork was improved, and the motivation of staffs just improved just by implementing 5S, reduced waiting time for our clients. It improved greatly. There was reduction of waiting time for our clients, and then there was improved storage of our supplies and our supplies and records were highly improved. Then the privacy of the patients, then increased utilization of services for our patients. There was improved relationship between health workers and our clients and patients, which is a very good thing. There are so many things. Waste management greatly improved. So infection prevention and control was drastically improved just because of implementation of 5S, to mention but a few.
That's very good. I really like the outcomes of 5S.